Good morning. Today's class is on mercury toxicity and mercury hygiene. The topic will be covered under the contents of introduction, the different forms of mercury exposure in the dental office, the sources of mercury exposure, mercury levels, the side effects of mercury, which include allergy and toxicity, the treatment, mercury hygiene, and mercury-free alerts. Coming to the introduction, mercury poisoning, which is also known as hypercaria or mercurialism, is a disease caused by exposure to mercury or its compound. Mercury is a heavy metal which occurs in several forms, all of which can produce toxic effects in high enough doses. Mercury usually exists in three chemical forms, which include elemental mercury, inorganic mercury, or organic mercury. Elemental mercury is the most volatile type of mercury. It exists in liquid or vapor form. It can be inhaled and absorbed into the lungs and GI. It is the most common form of amalgam restoration. Exposure to this type of mercury can occur due to accidental spillage of mercury in the dental office. Inorganic mercury is usually mined as inorganic sulfide ore. It usually exists mainly in the liquid form. It can also exist in other forms other than sulfide. It is irritating in nature and the main route of entry is through the lungs. Organic mercury exists mainly in the form of methyl mercury. Its main route of entry is by the absorption through the GIT, though food. It is used in fungicide and pesticides. It is found in vegetables, fruits, and grains, and it is toxic in nature. Coming to mercury exposure in the dental office, it usually occurs due to the amalgam raw material which is being stored in the office. It can also occur during trituration, insertion, and intraoral hardening. It can be exposed in the form of amalgam scrap during finishing and polishing and during the removal of old amalgam restorations. Coming to the pathways of mercury toxicity, mercury released from the amalgam is inhaled and 80% is up to 80% uptake can be seen in the lungs. The amalgam then distributes throughout the body and the nervous system. The mercury then breaks down to inorganic mercury, which then accumulates in the nervous system, liver, and the kidney. Severe forms of mercury toxicity can result in neurotoxicity, nephrotoxicity, teratogenicity, and can even result in death. This is a graphical representation of the related sources of mercury exposure. So we can see that the maximum amount of mercury toxicity occurs to the patient or the clinician or human beings in the form of amalgam. Coming to the side effects of mercury, there are two common side effects of mercury which can be observed. These include allergy and toxicity. Allergy is a response which is an antigen antibody reaction marked by itching, rashes, sneezing, or other symptoms. Contact dermatitis or Crohn's type 4 hypersensitivity reaction represents the most likely physiological side effects to dental amalgam. Due to toxicity, toxic effects of mercury depend on the amount of exposure, the length of exposure, the length of mercury accumulation in the body, the amount of accumulated mercury, and the overall health of the patient for detoxification. This is a graphical representation of the levels of mercury toxicity. Coming to the effects of mercury poisoning, there are few acute symptoms. When mercury ingestion occurs, there is local corrosive effects, nausea, vomiting, severe abdominal pain, chemical colitis, or renal damage. When inhalation of mercury occurs, there is chemical pneumonitis and pulmonary edema. The chronic or long-term effects include classical symptoms such as tremor, gingivitis, erythema, renal and CNS damage. Minimated disease is a neurological syndrome caused by severe mercury poisoning. These are the many signs and symptoms which can occur due to long-term or short-term mercury exposure. These include memory loss, allergies, mental confusion, irritability, high blood pressure and heart problems, weight gain, digestion problems, fatigue, skin rashes, joint stiffness, cold feet, balance problems, and immune dysfunction. Psychological disturbances can also occur, which can be elicited in the form of fits of anger, short-term memory loss, low self-esteem, loss of self-control, sleepiness. A person may also suffer from the loss of the ability to learn new things or things that require memorization. Coming to the oral manifestation, there can be inflammation of the mouth, loss of bone around the teeth, ulcerated gums and other areas in the mouth, darkening of the gums, taste of metals, or bleeding gums. GIT problems include cramps, inflamed colon, and diarrhea. Cardiovascular system problems include weak pulse, increased blood pressure, chest pain, or a feeling of pressure in the chest. Respiratory problems include weakness and problems with breathing, emphysema or persistent dust. Neurological problems include headaches, vertigo, tinnitus, or twitching in various areas of the body, such as eyelid or the feet. Toxic effects of mercury toxicity include damage to the brain, kidney, and lungs. Mercury poisoning can result in several diseases, including heterodynia, which is also known as pink disease, Hunter-Russell syndrome, or the Minamata disease. Signs and symptoms include peripheral neuropathy, skin discoloration, swelling, and discoloration or staining of the skin. As we discussed earlier, this is a summarization of the symptoms of mercury toxicity on the oral cavity, which include bleeding gums, alveolar bone loss, loosening of the teeth, excessive salivation, foul breath, metallic taste, burning sensation with tingling of lips in the face, tissue pigmentation, which is also known as amalgam tattoo of the gum, stomatitis or soreness in the mouth, ulceration of the gingiva, palate, and the tongue. Acrodynia or Pill's disease is considered to be a mercury allergy. In this, there is erythema of the palm soles, edema of the hands and feet, desquamating rash, hair loss, pruritus, diaphoresis, tachycardia or hypertension, photophobia, irritability, anorexia, insomnia, and poor muscle control. This is an image of Pill's disease or acrodynia caused by mercury poisoning. Hunter-Russell syndrome is a syndrome characterized by paresthesia, visual field of constriction, ataxia, impaired hearing, and speech impairment. Minamata disease is a disease diagnosed in 1956, which is linked to fish consumption. In 1957, fishing was banned in that area. In 1959, mercury was identified as the cause for the issue. In 1960, the source was identified as factory effluents. During this period, 2,000 cases were reported, in which 41 deaths and 700 permanent disabilities occurred. The symptoms of Minamata disease were ataxic gait, convulsions, numbness in the mouth and limbs, and constriction in the visual field, as well as difficulty in speech. Its treatment of mercury poisoning involves chelation therapy, in which there is administration of chelating agents which remove heavy metals from the body. A chelating agent can be given orally, intramuscularly, or intravenously. DMSA, which is an FDA-approved use in children for treatment of mercury toxicity, is the most common treatment modality. Mercury hygiene and other parts of mercury toxicity will be discussed in the following classes. Thank you.